Good afternoon. I'm still getting this message of reconnecting. So I don't know what that's all about. It just makes me crazy. Today we're going to do part 2 of what we started with last week. We started with a report that is entitled U.S. Children Have an 80% Higher Death Rate Than Other Children in the World. And so this is very disturbing. We got through part 1 last week, and so we're going to go through part 2 today. Now we are going to do a little bit of a recap, so if you did not get last week, you're not going to be totally in the dark, okay? But we really want to focus on the major culprit, which is our food. All right, we didn't really touch on this last week, but we're going to touch on this today. But the reports show that U.S. infants are 80% more likely to die before their first birthday, and children overall face an 80% higher death rate than their peers across 18 different developed countries, okay? The comprehensive study, which examined health trends from 2007 to 2023, reveals that the United States experiences in excess of 54 deaths per day more than other developed countries. So this is just kind of crazy. Why is this happening? Well, a lot of it is because of chronic conditions that have surged. A child in 2023 was 15% to 20% more likely to have a chronic disease than a child in 2011. So that's a 12-year difference, okay? But the increase of chronic disease was 15 to 20%. The proportion of children aged 3 to 17 with at least one chronic condition rose from 26 to 46%. Now, it's almost a 100% increase on that. So what is driving this? I'm going to tell you what's driving this. It is processed foods. Our foods are not getting healthier. They're getting worse. I have very high hopes for all of these companies that are coming out and saying that they're going to remove all the dyes. They're going to remove all these carcinogens that are in our food. And the highest chronic condition for children is, guess what? Diabetes and obesity. Right? I'm seeing more and more heavy children, and we just didn't see this when we were younger. You know, when we were years ago, we just didn't see this. We're seeing it today. Despite spending nearly twice as much on healthcare as other high-income nations, the United States sees worse health incomes. I think we're like on 18 out of 18. We've got the worst health outcomes of the developing nations, and this is really not helpful and not exciting when we live in this nation, right? And this is why we have to do a lot to keep ourselves healthy, because our food supply is just not great. 93% of U.S. adults are metabolically unhealthy. Now, this represents a widespread of chronic diseases and poor metabolic health. The United States has the highest chronic disease burden and obesity rate, which is twice what you see in other, comparable countries, high-income countries. We are twice the number of chronic diseases and twice the number of obesity, okay? This is a metabolic disease. What is metabolic? Metabolic is the way your body functions at the cellular level. And so if we are not functioning correctly, then we're going to be more prone to these diseases. So what causes us to function correctly? Good, whole food foods. Now, in this country, at this moment, we're not real excited about grains, okay? The reason we're not excited about grains is because grains are sprayed with glyphosate twice, right? Gives more yield for the farmer, and I'm not against that, but the grain gets contaminated with heavy metals. That goes in our system that causes us not to be able to absorb our nutrition, which leads to metabolic disease. This is why I do the Life Pack Nanos every day, twice a day, because this is what is made out of fruits and vegetables, very high density fruits and vegetables, so that my body has what it needs in order to support it metabolically. So I'm not heavy. I don't have any chronic diseases. I don't have diabetes. I don't have any autoimmune disease. I don't have any thyroid disorder. I don't have anything like that. Why? Because I take a good supplement that is guaranteed to work. Now, a lot of you out there are buying your supplements from the big box stores and online, and I just want to discourage you from doing that. Part of the reason for discouraging you is you don't really know what you're getting. All right, you don't have the cofactors in there. I've done other videos that have compared this to this, and we've got the cofactors that are not there and what you're getting at the big box stores and online. And also, we told you this before, this is the Pharmanex scanner, and this proves that these work. Okay, and so if you're going to spend money on supplements and you want to make sure that you're getting supplements that you are able to absorb, that you're able to, it goes into your body does what it needs to do with the enzymes in your body, and it does all those chemical exchanges so that you can be metabolically healthy. So in the United States, we are not metabolically healthy, and our children are not metabolically healthy. And this is a real big deal because I have children. I have grandchildren. I do not want my grandchildren dying. I don't want them to be in the 80% premature death that is the statistics that we have here in the United States. All right. There was an editorial in JAMA, Journal for the American Medical Association, and it stated that the United States has the highest child poverty rate and income inequality in the developing nations. All right. This means that parents who are at the poverty level, they rely on cheaper and less calorie dense foods. Well, let me put that a different way. Less nutritionally dense foods, but higher calorie foods, right? And so their children are getting empty calories. They're getting a lot of fats, they're getting a lot of sugars, they're getting a lot of processed foods, but they're not getting a lot of nutrition, and therefore their body doesn't have what their body needs in order to perform properly. So the study did not break down the results by the demographic groups, but there are studies that show that you are able to eat better when you're at a higher socioeconomic level. Now that it's understandable, but it's not great, because we need our families that are at a lower level to have the access to good food. And this is one of the problems that is driving the death rate of our children. Now, Linda Van Horn is a research nutritionist at Northwest University's Feinberg School of Medicine, and she says that these economic disadvantages create cumulative effects across families and communities, broadly influencing U.S. public health in ways that perpetuate the cycles of poor health. These health disparities often overlap with social conditions that contribute to both violence and crime. Now, I never really connected violence and crime and poor health outcomes. Well, yeah, if you get killed, you got a poor health outcome. I mean, that's kind of a no-brainer. But this study goes on to show that chronic health conditions, health, and crime appear to have a two-way relationship. Children exposed to violence have been linked to chronic physical illness and later mental health problems. Violent and criminal behaviors have also been linked to poor nutrition. Now, we knew that. We knew if you did not have the wherewithal in order to have your brain thinking properly, right, then you would make bad decisions and you could get into crime and violence and that kind of thing. But we did not know, or I did not know, that exposure to violence and crime causes you to have a negative impact on your health. Now, I will just tell you, when I was a young mom, right, we did not let our children watch horror stories. We did not let them play on the, I'm going to say Nintendo, but that might not have been the only gadget that they had out there, because a lot of the games were violent and we didn't want them to be seeing that and be participating in that. And so this is something where we do see a lot of parents just, put the children in front of a tablet just to keep them occupied. And I don't really think that that's a great idea, because so much of it, the offerings out there are very, very violent. I know that when we get, a television show coming on Netflix or whatever, if it's excessively violent, it's like, I'm not watching that. I don't want that in my home. I don't want that in my brain. I don't want that. And this study shows that when children are exposed to crime and violence, their health deteriorates, all right? Their mental health deteriorates. And this is not only if they're a victim of crime, but this is just if they're exposed to it. And you can be exposed to it here in the, in the physical, in the the day-to-day living, or you can be exposed to it through videos, movies, and all that kind of thing. So while lunches in many U.S. schools rely on processed and prepackaged foods, other nations prioritize fresh, whole food-based meals. Now, I know school just started for a lot of us this week, maybe last week, and so it's top of mind on what's going on with the school lunches. Me, when I was a mom, I made their lunch every day, so they had good, whole foods. I'm not saying they never bought their lunch, but they didn't buy their lunch every day. And so in a 2021 JAMA Network Open study, found that 67% of calories in U.S. children's diets come from ultra-processed foods. A 2024 article in the Journal of Nutrition, Education, and Behavior noted that many school lunches still include processed foods despite the growing concern about their effects on children's health. Now, the schools updated their meal standards in 2012 to match the dietary guidelines for Americans, but the parents are unconvinced. Now, I remember when Michelle Obama came out and she said, we're going to change the school lunches, we're going to have this, whatever this was. I was out of the school by then. My kids were grown by then, so honestly, I didn't pay a whole lot of attention. I did hear that nobody liked the lunches, because it's not what they were used to. And I'm just going to say that as we are having our food, certainly our packaged foods, revamped, and I'm glad they are, I'm really glad they are, they're not going to taste the same, okay? So back in the day, before I had educated myself on foods, one of my favorite, and I've said this out loud lots of times, one of my favorite foods is, comfort food, is macaroni and cheese. I love macaroni and cheese. As a little girl, Luby's macaroni and cheese was my favorite thing. Okay, and as I grew up, I learned how to make it just like that. And I made it with good ingredients, but it was creamy and all that kind of thing. And so that is one of my comfort foods. Now, rarely do I succumb to the blue box that you can get your macaroni and cheese in. But back in the day, I had a taste of it, and I knew what it tasted like. And in the years that I lived in Scotland and England, when I would purchase that same blue box, it tasted totally different. Why is that? Because Europe bans a lot of the flavorings, a lot of the additives that we allow here in the United States. And so the food tasted different. Didn't like it. My taste wasn't turned toward that. So what we're going to find as these companies start cleaning up their act, and yay, I'm glad that they're doing that. If you are someone or your children are someone who eat a lot of processed foods, you're going to find that their taste buds are not going to like what's coming out because they're not going to have the extra sweeteners, they're not going to have the addictive, things that they put in the food, so that your child is not going to want that, okay? But also you're going to be able to have a healthier option. So we know that what we have in the schools is ultra processed. They did do a little bit in 2012, but if you look at the ingredients, if you cannot pronounce your ingredients, you're eating a lot of processed food, and we don't want to do that. We want to be able to pronounce every single ingredient of what we're eating. Now, the U.S. Centers for Disease Control and Prevention reports that the United States childhood obesity rates have tripled since the 1970s, affecting 20% of children and adolescents by 2020. Scientific research has highlighted the connection between diet and health. In a 2024 study in the journal Nutrients, it found that children eating high levels of ultra-processed food had increased risks of obesity, insulin resistance, and mood disorders. Additionally, Frontiers in Nutrition reported a correlation between diets high in processed food and cognitive function in children, including memory, learning, and attention. So this is one of the things that we're seeing with all of our children. Everybody's talking about how poor their manners are. Okay. We've been having all kinds of computer issues these days. I do not know why, and so you're just going to have to bear with me on this. So what are other countries doing that we are not doing? Well, in Japan, the school meal program emphasizes fresh, whole ingredients such as fish, rice, vegetables, and soup. Now, I don't ever remember having soup as a choice at school. I may have, but I don't remember. Now, my mom was one of the good moms, and we had homemade lunches, going to school. And back in the day, we didn't have as many additives in the food as we do today. So, we're doing that. So Japan has soup in their lunches. As a result, Japan's childhood obesity rate is just 3.9%, which is one of the lowest in the world, according to a 23 study in JAMA Pediatrics. Japan's nationwide school lunch programs plays a key role in its low childhood obesity rate. The program offers balanced, made-from-scratch meals with controlled portions and diverse foods. In 2019, the study conducted from 2006 to 2015 found that among junior high school boys, a 10% increase in school lunch coverage led to a 0.37% drop in overweight students and a 0.23% drop in obese students. So what do we have here in the United States? In the United States, 2 in 3 of us are overweight. 1 in 3 of us are obese. So a third of our population is obese, and that's pretty tragic, because if you're overweight, it's easy to become obese. If you're obese, you've got I think it's twice the incident of developing diabetes. So your chance of developing diabetes doubles. Once you have diabetes, your chances of developing cancer is increased by 4 times. You got 4 times the opportunity to have cancer. So we don't want to do this. And so this is why metabolic health is really, really important. So in Sweden, the schools provide free, locally sourced, nutritionally balanced meals to all students, ensuring access to healthy food, regardless of their socioeconomic status. And so this is something that's really, really important that we do not have in this country. Although I read just today, I don't remember what school district or what state it was in, but I read today that they were doing away with all of their meal applications, and every student in the school district got a free meal. And so that's not necessarily a bad thing, especially if it's not the ultra-processed foods. That's what we do not want. We do not want the ultra-processed food, and those are the things that are so addictive. So think about what you eat that you can't get enough of. Okay, we used to say, and maybe we still say, that was really good, and it is, or it has more-ish. Okay, what is more-ish? More-ish is I want more. Okay, I ate a portion, but it was so good, I want more. And that is because of the addictive things that are in our food. So we're finding that students in other nations don't have that, and that is one of the reasons why they live longer, they have less chronic disease, and they just do better, is because they don't have all those additives in there. So Sweden provides free, locally outsourced foods, right? Its meal program tackles obesity by combining nutritious meals with education on food, health, and physical activity. Now, this is according to a 2021 study by the Global Child Nutrition Foundation. Now, in France, now I don't know if you've ever been to France, but I enjoy France. I enjoy French foods. I'm not going to lie about that. I love the creamy sauces and all the richness. I'm just going to be right out there. I love that, right? Well, you wouldn't necessarily think that France had a healthy outlook on food. because of all the richness. However, they don't have all the processed foods, and your body is able to handle that. Look at all the French women that you see. I've been to France multiple times. You don't see anybody obese over there, okay? You just don't. And why is that? They eat all the fat, they eat all the carbs, they do all the things. It's because they don't have the additives that we have. So their school cafeterias have banned ultra-processed foods, and they focus on high-quality, fresh ingredients. The school meals are designed to teach children healthy eating habits that last a lifetime. Vending machines are banned in French schools and have been since 2005 to reduce the exposure to sugary and processed snacks. I wish we would do that here in this country. I wish we would ban vending machines. I know there are a lot of people, I have people in my family that make money on vending machines, so sorry, not sorry, but all of the food in the vending machines are ultra-processed, very unhealthy, full of preservatives, full of additives, and have almost zero nutritional content. So these are empty calories that make us insulin resistant, heavy, maybe even obese, which leads to chronic sickness and disease. So we need to follow France in banning the vending machines at our school. In France, a mother, she says, at lunchtime, our kids will eat grilled chicken breasts and salads. This is a quote from her. She says, at a high school, it is self-service with choices of an appetizer, a main course, and a dessert. Well, that doesn't sound like any of the school meals that I had. I mean, we got a tray, food was put on the tray, we got a drink, we were done. That's just how it went. Here in France, they have options, and they're healthy options. And you know what? When food is, when you have more of a choice, when you can make those choices, because she said they have options, when you can make those choices, you're going to pick foods that satisfy you, you're going to enjoy your lunch better, and you're just going to have an overall healthier response. She also said, her name is Sophie, she says that many high school students in France have a long lunch break, typically 1.5 to 2 hours. Now, I think back in my day, we had a 30-minute lunch break, which is hardly enough time to do anything. But in France, they have 1.5 to 2 hours for lunch, and the students can either eat in the school cafeteria, they can leave the campus and go out to eat, or they could even go home to eat. So for the French students, lunch is a time to pause, connect, and appreciate good food. The focus is on fresh, seasonal ingredients, mindful eating, rather than just filling up quickly. Now, the United States, we're back to us, we struggle to provide fresh foods for various reasons, including cost, infrastructure, and food safety regulations. Now, I don't know why our safety regulations would be any less stringent than European countries, right? If they can do it, we can do it. We just don't have a will yet to do it. And this is something that I'm applauding all of the parents who are doing all the things that they do, right, making their lunches and that kind of thing. But also we need to go to the school board meetings, and we need to demand that we have a better choice of ingredients for our schools' lunches. Low-income communities struggle with the higher cost and limited access to fresh food. Additionally, many U.S. schools lack the supply chain and staff to prepare fresh meals at scale, according to a 2024 study published in the Journal of School Nursing. These challenges were especially evident in the pandemic back in 2019 and 2020. So compliance with regulations such as rules for keeping foods cold also have an extra burden. Now, I don't understand why this is so much more onerous here in the United States than it is in other European countries. I mean, they have the same economic, standing here. Why can they do it and we can't do it? I don't know. Maybe this is something we need to look at. Despite the challenges, the Department of Agriculture programs such as the Patrick Leahy Farm to School program are helping schools incorporate more locally grown foods into their meals. One of the biggest strengths of the U.S. school meal program is the ongoing shift toward offering more made-from-scratch meals and incorporating locally sourced ingredients. Now, this is a statement by Ashley Robbins, Yay Ashley, and she is a Texas-based school dietitian. School nutritional professionals are transforming the perception of school cafeteria food by enhancing meal quality and integrating nutrition and culinary education to promote healthy eating habits among the students. So this is, thankfully this is happening in the state of Texas, but what we want to do is to be metabolically sound. Not only me as an adult, but my children. So remember, I do this, the vitamins, but I also do, here's my little orange drink here. It doesn't taste like orange. It tastes kind of like tea, but this is M-Smart, okay? M-Smart stands for Meal Smart. And what does this do? It helps me metabolize, comes like this. You do one of these in water. It says on the package you do it 8 to 12 ounces of water, I think it is. I do mine in about 4 because I like a stronger taste. But it tastes kind of like iced tea. And what this does, this is a supplement. It is a metabolically based supplement. And what does that mean? That means it's going to turn your food into the right kind of calories that you need so that you can actually use the food. Okay, even if you do eat carbs on occasion, and even if you do have some sugary snacks on occasion, when you add M-Smart to your diet, it helps you metabolize those foods in a way that it doesn't cause that up and down of your blood sugar, right? And you feel fuller longer, which means you're not going to be having those snack attacks all the time. And so when we're having snack attacks, that is a metabolic disorder. That means what you are eating, you are not metabolizing. You're not doing the uptake of the nutrition. And so if you add something like this that takes the chemistry of the food, helps your body use it the way it is supposed to, then you're not going to be hungry all the time. If you're hungry all the time, it's because you've got nutritional deficits and your body is saying, feed me, feed me, feed me, because I'm not getting enough to eat. And you may have had tons of stuff to eat, but if it was ultra processed, there's no nutrient density, so it doesn't register in your appestat, in your brain, and so your brain keeps crying out for more and more and more because you're not getting what you need. This is why M-Smart is so important, because it changes the way we metabolize our carbs and sugars. And remember, broccoli has carbs, asparagus has carbs, potatoes have carbs, carrots have carbs. All of our fruits and vegetables are carbs, okay? So when you hear people say that carbs are bad, no, not all carbs are bad, just your refined carbs. But even if you on occasion have refined carbs, if you do the M-Smart, you will not be metabolically challenged when you eat those kind of foods. And so what we want to do is train our children to choose good, healthy foods. We also want to give them good vitamins. These are not for children. These are for grown-ups, like 50 plus. But we can give them the M-Smart, right, to help them metabolize what they're eating so they're not hungry all the time. And that is going to fuel their bodies because they're going to have the nutrients that they need so that they can be healthy. And that's what we want. That's what we want for our kids. It's a sad thing when the children in the United States of America have an 80% higher death rate because of what they're eating. Okay? There are other things as well. But what they are eating is the primary cause. So you've got a lot of information today. We've got a lot of products for you to try if you want to try anything for your kids and you or, your family. We've got answers. We do have answers. That's why we do these little lunch and learns, is to communicate with you that all is not lost. All right. You can eat the foods you like, not ultra processed, please, but on occasion, right, you can, and you're not going to suffer the gas, the bloating, all that kind of stuff, and you're going to metabolize them the way you're supposed to. So you're going to have the nutrition that gets to your brain so that you're going to be really smart and have a great life. It is the weekend. Rest, recover, rejuvenate. and restore. And I will see you next Friday. Thanks for joining. Thanks for liking. Thanks for sharing. Thanks for doing all the things that you do so that people know that we're here and we've got just cutting edge technology. We've got cutting edge information, and we want to just help you with that. So I will talk to you next week.